Well, good morning, everybody, and thank you very much for inviting me to talk to you today. I thought I might give you a little bit of background. I've been involved in risk management for a very, very long time, well over 40 years. And the initial request was that I talk about something to do with risk management. I thought, though, that it might be better to focus on something fairly specific. So I thought we'd talk about vulnerability, which fits in with the current crisis that we're in at the moment. I've been doing risk, as I said, for a very long time, and analysis of vulnerability and disruption is just one part of dealing with uncertainty, which is what risk is all about. The invitation came to me, as Anand said earlier, because I've been doing some work over a number of years with World Vision. That came about through a long and circuitous route. Nearly 20 years ago, I met some really nice guys from Mumbai in Abu Dhabi when we were working together with the Abu Dhabi National Oil Company. And they invited me to do some training with them. And a couple of people at the training course were from World Vision India. And about 18 months after the course, maybe a bit less, I had a connection from Mrs. Malini Ambudayan from World Vision India, who had been at the training course and had taken all the notes and had developed a way of dealing with risk management in World Vision India, and she wanted me to have a look and see whether it was good. And it was absolutely fantastic. It really was, and I was very impressed with the initiative and with the skill and the work that she and her colleagues had done. And so we started a dialogue, and ultimately I ended up doing some more training for a wider group of people across World Vision through Southern Asia and the Pacific. I then did some more work with World Vision International from California, and then I was invited back to Chennai to talk to some of the leaders of World Vision India and CIM about enterprise risk management. So I guess it's a long way of saying I've had some dealings with people in India who have been working in your sorts of areas over some time. And I've tried to put together some material that I hope is going to be useful to you. I want to, I'll talk a little bit about what we're going to do, then we'll talk a little bit about understanding our mission. This is a very, very important thing that applies to many activities that we do, whether that's planning, strategically planning our activities, or as we're talking about today, thinking about vulnerability. Then we'll talk about some simple ways of looking at vulnerability, and then some lessons and some final discussion. Now, the purpose of today's session is to think about how our mission might be disrupted and how we might think about responses. There are a number of things that Anand and Dr. Jayakumar mentioned that actually link in with what we're going to talk about. I think the initial thing of never let a good crisis go to waste, or something like that, really fits in with some of the things that we're going to be talking about today. And I'll try and link in some of those earlier lessons from Jayakumar that I thought are actually very, very relevant, as were some of the things in Anand's initial descriptions. As we go through, there'll be some templates, and you'll see there's a little a five-sided figure there with a T1 in it. You'll see these as we go through. They link to tables in the set of Word templates that you should have had before this session today. They're referred to little tables that we'll use on the way through. I've provided those to you in Word form so that you can use them in your missions. You can adjust them. They're in Word, so you can play with them. You can reproduce them. They're things that are provided for you to use. And you might follow along with those as we go through. There are references to them as we go through what we're doing. And at the end of the morning, I hope that you'll be able to see how to use these to do things that are useful to your day-to-day activities, as well as to use them for this little exercise that we're going through today. Some of the templates might seem very simple and maybe even unnecessary or self-evident. They are simple because we find in our work that simple things are useful. They're useful for communication. That was something that Joe Kuma mentioned, communication, communication, communication. We find very simple little tables like the ones that we'll be talking through are really helpful because they are simple. They allow you to communicate easily. So I don't make any apologies really for simplicity, and I don't make any apologies really for the fact that some of them are unnecessary or self-evident, because in practice we find that many of the self-evident things are hidden away. They're hidden away in our assumptions and our understanding, and sometimes we forget them. So as we go through today, please think about following all the steps, because all the steps will help you actually achieve the outcomes that you want. And the outcomes that you want are generally to get good results for your purpose, which we'll come to in just a second. And again, reinforcing some of the things that Joe Kuma said in his lessons, his 7 lessons. As we go through though, we're going through a particular example, but as we go through, what I want you to do, please, is to think about how might this apply to me and what my organisation does. They are really simple, they are general, and they are the things that we use in our consulting practice. We use these things all the time. So although we're using a very specific example, as we go through each step, please think about, okay, that's how it applies here, but how could I apply it to my activity? So let's go through and let's start. The purpose of this section, understanding our mission, is to make clear and to make perhaps a bit more transparent some of the things that Joe Kuma mentioned. For example, Joe Kuma's second lesson was to be stubborn about our vision and mission. In other words, focus on our objectives. Why are we here? What do we want to achieve? This, I think, is absolutely critical for everything that we do. I come from a risk management background, so I see this as a very important part of what the risk management standard calls the step of scope, context, and criteria. But it's actually, all of these are really essential for doing your strategic planning, thinking about how you might engage in your activities, how you might engage in your mission, how you might manage your school or your hospital, or your church, whatever activity it is that you are doing. All of these things are absolutely essential first steps. And the reason that I want to go through, as I said, the reason I want to go through these in a bit of detail is they're not always articulated very clearly. They are very often assumptions, and they're not always in front of mind. And sometimes, though, we actually need to make them front of mind so we can refer to them as we go through a particular activity. So we need to understand very, very clearly what's our mission purpose, why we're here, options that underpin what we do, and we need to understand how our purpose translates into our objectives. And the first two templates are really designed to help you do that. These things are very, very specific to you. So I haven't included many here. I've included a set of vision, mission, and values that come from World Vision International, which I think set out very, very clearly what World Vision's aims and mission are all about. And I expect that you all have very similar things in your own missions, in your own organisations. I certainly hope so. This is the very high level statement, which comes hopefully from your strategic plan. And you will have a set of specific objectives that underpin that. You need then to extend that to the specific activity that you're looking at, whether this is at a low level. We're looking here at an example that's relating to a school, a community primary school. You may have this for your hospital, for your church, for whatever, or you may have it for your organisation, so it may embrace a set of lower level activities. But you need to have specific objectives, and you need to know how would we know whether we've achieved a good outcome? Now, these indicators, these things might not all be quantified, but sometimes that helps. But we need to have a very clear idea of what we're doing, why we're doing it, and how we know whether we've succeeded. And the little table in the templates allows you to do that. Here is a very simple example for a little case study today, which is about running a community school. Community school provides basic primary education for children, and we also provide breakfast because some of them maybe don't have as much food as they would like. We do it because and enhancing their capabilities and helping them to lead better lives. And how do we know whether we've succeeded? Well, parents support what we're doing. Can we quantify that? It might be a bit difficult, but we might be able to quantify whether we get good attendance rates and whether we get good participation rates from volunteers who help us in our activity. So, very simple little template. You might use a lot more detail if that helps you in your particular activity. For today's purpose, I've kept it very, very simple. But very simple thing that sets out what we're doing, why we're doing it, and how we might know if we've succeeded. So just a starting point. Next, we might need to think about who our key stakeholders are, who's involved with what we're doing. And why is this? Because they have objectives, they have expectations of us, and we might need to take those into account as we go about our business, because that will help us think about what we need to do, and it will also help us think about whether or not we've achieved what we set out to do. And they might cover a wide range of things. They might be our own people, the people that we serve, our customers or community that are affected by what we do. In this case, we might be thinking, well, today, right now, we might be thinking about the people and communities who are affected by COVID-19 and how that influences the way they interact with us. And there are suppliers, donors we've already mentioned in some of the comments when in Jai Kumar's questions there. There might be government activities, special interest groups, and there might be, in many cases, regulators who govern or constrain to some extent what we do. And again, we use a very simple little template for this kind of thing. 2 columns, who are the key stakeholders, and then what are their objectives and what are their expectations of us? Expanding just from our own little narrow point of view to think more broadly about the community with whom we work, the suppliers with whom we work, the regulators who affect what we do, and the donors who support what we do. Simple little table. You might extend this, you probably should extend this in order to get a more complete picture of what is important for you and your activities. Again, as I said, we use these little tables for many of our activities because it's part of setting the context for risk management, and it's part of doing the, I guess what the planners often call environmental scanning as we do strategic planning or business planning or mission planning. After thinking about stakeholders, we need to think about what external influences might affect what we do. What are the factors that have implications for what we want to achieve? And are those things enablers? Do they help us do things better, or are they constraints? Do they restrict what we can do? And there are lots of ways of thinking about these things. We often use the little acronym PESTLE as a checklist to make sure that we've thought about a range of things: political, economic, social, technological, legal, environmental. Here's a little example where I've started to fill in at least one factor against each of those headings for the school that we're talking about today. A local political personality wants to start his own local school. Okay, well that might cause difficulties if he has good connections with the local authorities, if we're seen as a barrier to that. Economic, local people need our support, so we rely on volunteers, external donations to provide our services, because they're relying on us, for example, for what we do. So many of you will recognise this as another building block for a strategic plan or a mission plan. And as always, expand this for your activity. There's usually more than one factor. I've just included one for today's purposes, but you might expand that for your activities. External factors, we also need to think about our own capabilities, our strengths and weaknesses, our culture, our capabilities and resources. We sometimes use 4 Ps for these: people, places, policies and processes. I like these little checklists because they mean I very often don't forget things. So here's a little template for that. People, we don't have many local teachers. If we have to bring new teachers from other parts of the country or other areas, they might not know languages or customs. We might need to, so we might have room to increase the offering that we can provide to the students we teach and the ones that we feed, and so on. We can put in more here. Again, I've just included one factor per heading here, but as you apply this to your activity, to your mission, then there'll be many more things that you might need to include. And include as many as you need to provide a complete picture. The idea here, I guess, is so that you can say to someone, this is what we're looking at, and here are some of the key things that influence the way in which we look at it. And that someone might be someone who's come in to help. It might be someone who's a donor who says, how is my money being spent? And you can say, well, here's what we're thinking about. Here are some of the things that underpin the way in which we think about some of these particular objectives that we have for the activities in which we're engaging, the specific objectives and criteria. Now, the criteria for success, the things that we might need to think about for this particular activity. And these are perhaps more detailed than the more general things that we talked about earlier. We've got some general objectives for our mission, but now we need to translate them to specific objectives for this particular activity. In this case, for the school that we're thinking about. And we'll use these as a guide for judging how we might be disrupted if something happened. So we're now getting much more specific. We've talked about the general things that we want to achieve for our general mission. Now we're getting more specific to the objectives for this particular activity. And if we were using these in a risk assessment, these would form the basis for the scales we use for analysing the consequences of risk. And for our school here, I've just noted some of them. We want good performance. We want good educational and health outcomes for the children that we teach and we feed. And this is a pretty straightforward objectives. We want to get good outcomes. We want to do it within our operating budget and our available funding constraints. That related to, I think that was, perhaps that was your question, Dr. Sunil, one of the questions we had anyway about how we achieve things when we have limited funds. Well, one of our objectives is to do things within our available constraints. But of course, constraints are only there to be tested in many cases, aren't they? If we have something that is a constraint, then the first question I always ask is, can we do something different that would mean that is no longer a constraint? In other words, could we get more funding? Can we increase our budget if that is going to be a limitation on what we want to achieve? Other criteria, safety, very often that's absolutely critical, and sometimes it's explicit. If we're running a hospital, it's absolutely critical and absolutely explicit. And right at the moment with a pandemic, it has a much wider ramification than just perhaps someone tripping over and hurting themselves, or perhaps making a mistake in a clinical setting. Image and reputation, particularly for our donors and for our regulators. We need to be able to convince our donors that we know what we're doing and how we're doing it. We need to be able to convince our regulators that we are competent at what we do and we should be allowed to continue doing things. And to underpin that, we need a lot of support from our community. So the community underpins our reputation and image. And those both support the compliance with obligations, whether they're formal or informal. So translating our higher level objectives through to specific objectives for the activity or school in this case, or hospital or church, whatever it is we're looking at in the particular instance, and then translating those into some criteria to say, well, if we achieve these things, then that's a good thing. If we can't achieve these things, then that might pose some degree of disruption to what we want to do. Now, why bother with all of this? Because it's all basic stuff, isn't it? Well, as I said, many assumptions are often implicit and not stated, and sometimes that includes why we're here. But if we have a very clear understanding of our mission and the environment in which it operates, then we're able to communicate more clearly and more easily, both internally to our partners and our staff and our volunteers, and externally to our communities, to our donors, to our regulators, to our partner organisations. And that means we can all work from a common base, and that means we reduce misunderstandings. It means we can all work towards common objectives. And that is absolutely essential if we're going to be able to do things effectively and efficiently. It saves so much difficulty if we have, if we can avoid miscommunication or misunderstanding, if we can all pull in the same direction. Because in practice, we know people have, very often differing views about our purpose. And this can lead to misunderstandings and actions that don't have outcomes that we fully support or don't fully support what we want to achieve. All right, now, we're using this today to think about vulnerability, but all of these steps and the templates that support them are things that you can use to support your strategic planning, your mission planning. They can underpin your risk management activities, because these are just parts of the context stage of a risk management process. If you follow ISO 31000, which is the standard that we generally follow in our work. So they're very, very general things. But we're using them today to talk about vulnerability. So let's move on to vulnerability. And what we do is to think now about things that might disrupt our activities. First section, set the scene, and provides the background for what we do. Now we're going to think about disruption in detail. But unlike the first section, this only uses one template, but it's got a few more columns. And we'll go through that in several steps. So we've got this, got the template, has a set of columns. First of all, we think about what we're vulnerable to, the first column. Then from there, we might think about those things by going, first of all, down the column. Then we think about, for each thing to which we're vulnerable, how would we be disrupted? How can we change that? And then some planning. What do we do now and who's going to do it? So the first step, thinking about what might cause us to be vulnerable, going down the left-hand column. Usually we brainstorm this first, brainstorm all of the things that might make us vulnerable, and then for each of those, we go across the rows for the detailed analysis. So we go across row 1, then across row 2, and so on down the table. So in each of these larger templates, we brainstorm down the left-hand column, then we do the detail going across each row. Now, having said that's the way to use them, I'll be perhaps going down each column just to show you each step by step. But so do as I say, not as I do. So first of all, identify the possible causes. What might cause disruption? All of the things, the events, if you like, or the circumstances that might lead to something happening that is different from what we plan. So someone might come along that has symptoms that, oh, someone's got a cough or a cold or a runny nose or a high fever. Maybe we know that a parent of one of our students has been infected, or a student has been infected. These are outside things that we might know about. Some of the things we do, some of our processes, well, we use towels for drying hands in our kitchen and in our toilets. Could that disrupt us? Well, maybe it might. Replenish our cleaning supplies. The government might cause all of our schools to close. That sounds familiar. Currently, where I am in Australia, they're just getting students back to school, very, very slowly though. And so on. There are a range of things there. To what are we vulnerable? First question, what might cause things to be disrupted? Next, if we are disrupted, so what? How might we be disrupted? What might change from business as usual for our mission activities? And how would that affect our ability to achieve our objectives? Well, let's see if we can look at some of these things. As I said, normally go all the way across because it's easy to all the way across. For today, because we're talking about how we do it, we'll just go down the column and see if we can note a few of the things. So if a teacher or a volunteer has symptoms or is diagnosed, well, how would we be disrupted? Well, the teacher or the volunteer might have to self-isolate. So that means that no one might be available for the class. And so we can't meet our teaching objectives, perhaps. Or if it were someone in the kitchen, then maybe we wouldn't be able to serve as many meals. We might not be able to serve breakfast at all. So we couldn't meet our objectives to give everybody at least one good meal a day. If a parent was infected, then maybe they're spread to other parents and to teachers and students, and that leads back to the disruption and some of the things that we might have had in the previous one. And so on down the way. So we use towels, and so what? We use towels for drying hands. Well, what does that mean? That means that infection could be transferred easily to other people. So if someone who is infected used one of those towels, then we have a way of transmitting disease. We have a vector for disease. So another source of disruption. Okay, so first of all then, what might happen? Next column, so what? And then the next column is, well, what are we going to do about it? How might we respond? And generally we start here by developing some high-level responses. And then for those that seem sensible, we'll go on to more detailed activities and plans. So, for example, some high-level responses. If a teacher has symptoms or is diagnosed, well, we might have to send them home. We'll have to adjust our teaching schedules. We might have to combine classes. We might have to ask some retired teachers to come back to assist. Or we might have to ask some of our volunteers to take over teaching things. Perhaps they weren't trained as well as they might have, as well as we would like, but we might have to ask them to do extra tasks. A parent has been infected. We don't want that to spread to other parents, so we might have to limit the way parents interact before school and after school, and so on. Using towels, we might have to move from cloth towels to paper towels for drying hands. And we can then now move on to detailed plans for those things that seem reasonable. So these get more detailed, so we have a little bit more here. So if we have to send someone home, then we might have to ensure the staff member notifies authorities if that's what the rules say. We might have to prepare a guideline for our staff to help them maintain isolation and to help them monitor, or perhaps we might have to monitor their symptoms. And we might have a local clinic nearby that we might have to ask for assistance or something like that. And that might be fairly important. So maybe Raja's going to do that, and he's going to do that by the end of next week. So that might involve preparing the guideline, talking to the local clinic for help with that, and then making sure we've got something that we can distribute. Other thing, we might have to adjust timetables to make best use of teachers. We might have to use our volunteers in a different way. We might provide additional training and mentoring for volunteers if they have to assist in teaching, if they haven't done that before. Then we might have to simplify the lessons if that's necessary. And again, we might have to do that over the next few days. So you see, we've thought about how, what might happen that might disrupt us, how we might be affected, how that might affect what we want to deliver, and how we might deal with it. And now in some detail, and getting into quite a lot of detail in some cases, how are we going to deal with it? What do we do right now in order to achieve a better outcome? And this, we can start to extend. Here's another little example. We might have to use paper towels instead of cloth towels. Well, first of all, we've got to maybe liaise with our cleaners. And how do we actually get paper towels? We have to make sure there's plenty of soap. We have to make sure that people, particularly kids, how do we teach our kids to wash their hands really well? Because if your students are a bit like my children used to be when they were young, it's what we sometimes call a spit and a polish. Very, very quick. Wave it somewhere near the tap and it's washed. But actually, if we want to wash out COVID-19, we have to. I think the authorities here were saying you have to sing "Happy Birthday" all the way through twice while you're washing your hands under running water with soap. And most students don't do that. So we have to have a way of helping the children do it better, and we have to teach them. So a lot more detail. Now, a few key things here, just moving away from all of that detail. We can pull all those activities together, we can put them into groups, we can allocate them to people, we can develop action plans. That's general management things. Once we've done the thinking, the templates help us do the thinking, and then we can develop the plans, and then we go off and implement them. But just reflecting back on the detail here, first of all, it's a very general process that you can adapt to your activities, whatever they are. The example applied to a little school, and just very simple one-line responses in each table. You can apply that to any of your activities and you'll have much more detail in your responses. The early stuff applies in a very wide range of things. When we think about what we want to do, we've got some ideas. We need to think about advantages and disadvantages. And this links into some of the things, one of the first lesson that Dr. Jayakumar mentioned, opportunities. He talked about opportunities. One of the key principles of risk management that I always come back to, the key purpose of risk management is to create and protect value. A lot of people think about risk just as negative, and when we're out to stop things going wrong. But the critical part where risk management really helps is when you focus on opportunities to create better outcomes. And when you think about, should we do something, it's really, really imperative to think about what's the benefit, what are the advantages for what I am trying to achieve, for my mission, for my objectives. What are the disadvantages? Now let's weigh them up and make sure that the advantages outweigh the disadvantages. So always focus on opportunities. Look to make the best of what you can. Do things better. Create opportunities and achieve better outcomes. In order to do this, though, you need to refer to lesson number 2 from Jai Kumar. Be stubborn about your vision and mission. In other words, focus on your objectives. Does doing this help us get better outcomes? Does it help us achieve our objectives in a better way? Focus on objectives all the time. And that's one of the reasons why we tried to document them earlier in one of the early templates. So everyone is clear about what those objectives are. That way they can be stubborn and they can be focused because they're written down and they're clear and they're in front of everybody and they are communicated to everybody. That was lesson 4 of Dr. Jai Kumar. Communicated clearly and everyone is going in the same direction. The other thing about actions and what we do, when we react to a crisis, we end up very often in a new normal. This is lesson number 3 from Dr. Jai Kumar. We may not be moving back to where we were. We may be moving back to something that is stable, but it might be different and hopefully it will be better. Hopefully it will be better. So use the opportunity that a crisis provides. It forces you to do things. It forces you to do things differently. Use that opportunity to find out whether there are different and better ways of doing things that allow us to achieve more or achieve the same things more efficiently. So either to be more effective or to be more efficient, or hopefully both. So, and the other things that Jai Kumar mentioned are really things that support some of these things, looking at new partnerships, maximising our footprint, reinforcing the organisation's basics, and particularly reinforcing its objectives, why we're here and what our purpose is, the purpose of our activities. So that's about choosing the things that we do. Then we develop these action plans, and then the absolutely critical thing, make sure that they are implemented. We don't do this kind of analysis, this kind of thinking, just to develop some plans. We need to implement those plans so we actually achieve those better outcomes, so that we realise the opportunities and we enhance what we deliver in support of our mission and our objectives. Absolutely critical. All right, now some final things. First of all, simple approaches really work well. We've got lots of little templates here. We've talked through a lot of them, lots of slides, fine. But each of those templates is very, very simple. There are only 4 or 5 or 6 of them. They're very simple. We use these in our consulting practice with big organisations all around the world. We use them with small organisations when we're doing work with not-for-profit organisations in Australia, locally. We use them because they're simple, they are easy to understand, they are easy to communicate, and you can sit down with your team, and it doesn't have to be with your executives. You can sit down with your supervisors and with your volunteers, with the people who do the work, to complete them when you're looking at very specific local things. They are very simple, they are very straightforward. So keep things simple, don't overcomplicate unless you really have to. That will help make things clear and transparent and easy to communicate. So that's the first thing. And that's very, very important for pretty much every aspect of management, I think, and all of our risk management work. And I think you probably have with all of your general management work. If you can keep it simple so that people can understand it, then it is much more likely that you will achieve good outcomes. First thing. Secondly, you'll need to monitor the environment as the circumstances will change. Now, we're in the middle of a pandemic and it's evolving very, very quickly. I'm not sure what it's like for you in India, but here in Australia and in other parts of the world where I look at some of the news, there are senior people in the news, on television, every day, because things are changing every day. And one of the reasons why we had little templates for looking at the context, the external factors and the internal factors particularly, is so that we can see what we had assumed and see whether those assumptions still apply. And we really need to keep those tables updated as things change. If we have them detailed, if we have them documented, back in those tables, I think it was 4 and 5 and 6, if we can go back to those templates, we have them written down. They are assumptions about the environment in which we have to work. We have them written down so we can check to see whether they have changed. And if something has changed, then we have to ask, well, what's changed and what do we need to do now? Does it affect us? So what? Do we have to do things differently? In other words, has that change caused another disruption, or has it affected what we plan to do? And then the final lesson, which links into the monitoring aspect, is try and maintain as much flexibility as you can, because particularly now, as things are changing very, very, very rapidly, we know that what we do tomorrow will be different from what we think we're going to be doing today. You need to maintain flexibility because we know that disruption will continue. We know that things will change despite our best efforts. We'll put as much in place to maintain stability as much as we can, but we have to be prepared to monitor things and to move on and to do things differently. And Anne was talking about some of the key drivers that define us. We need to monitor those and make sure that we're on top of those. In other words, do we want to just sustain to exist, or do we want to transform? Maintaining flexibility allows you to transform. Right, that's pretty much the end of the formal bits. There's some templates there. We've provided those to you. If you haven't already got them, then Anand will send them out to you. They're not just for this presentation. We use them in our work for our clients. Please feel free to use them in your missions and adapt them as you need to suit your needs. But please don't overcomplicate them. Add lots of detail when you complete them, because the detail is important, but very often most of them are 2 columns. Very often that's a useful way of doing things. Keep them simple templates, but useful detail. The other thing, you'll find these notes will be distributed to you afterwards, I've made those available to Anand to send out to everybody. On there, you'll find a link to our website, the Broadleaf website, broadleaf.com.au, where there are lots and lots of case studies and lots of other material that you can use, not just for thinking about disruption, but for other aspects of managing your activities in your missions, whether that's your church or your school or your hospital or whatever else it is that you're doing, your little factory or whatever it is. And we provide those for people to use, and please feel free to access those and use them to support your activities. So I think that's really all that I wanted to say formally, and now I'll hand back to our organiser for questions and final discussion.
Thank you, Dr. Dale. You can continue to be there. We have indicated for the participants to have questions. Then you can go to the final. You have a final note. You can go to that. Okay, David, any questions? David, can you guide us?
Yes, so we've got a few questions. I'll just share the questions that came earlier first. I think we can answer that and then move to the next question.
Okay, sure, David. Sure.
Perhaps open it for maybe Mr. Jaykumar or Dr. Dale to answer these questions.
Yes. First question. We do not have regular donors. During past 15 years, we are mostly self-sustaining hospital with minimum surplus. We are running but severely affected with low income. How we can do partnership with others? What we should look in them for striving together? Dr. Dale and Dr. Jaykumar, any advice?
I'm not a specialist in the donor area, I'm afraid. However, I do a lot of work with organisations, helping them when they're thinking about their business planning process or mission planning in your context. And one of the things that they have to do is to go to their donors, which tend to be their chief financial officer or their shareholders sometimes, to say, I need funds to do a new project or do something different. And what I find is that some of the templates that we've talked through today provide a lot of the core material for the business plan that they might need to go along with to say, this is why I want some additional funds. Now, that's my experience primarily in the private sector, but I've also seen similar things used for one or two of the non-profit organisations with whom we work, where they are able to use similar kinds of things to go along to their donors to say, you've helped us in the past, we need a bit more help. Here is why we need some more help, and here is the reason, here is the justification for it. And some of the things that we've talked about today may be of assistance to you in actually making that case to your donors for additional funding.
Let me offer you some thoughts here on partnerships. This is a time for us to step up our partnership with the government very clearly. You and I have no option of isolating ourselves from the government. Crisis, the first responders invariably will have to be the government. And so as an organization, we need to know how to work with government. There is another question, I think question 3, which says, but the government wants us to do it through them. We need to find a way to do it without compromising on our integrity and standards. I still remember with the Tsunami World Vision, Tamil Nadu government said we'll have to work through them. And these are the standards they want. They said they will blacklist us if we did. So we told them we will not submit, we will not cooperate. We have standards to maintain. So we received a call from the secretary of the department who said, no, these standards don't apply to World Vision. We know your work. This is a time for organizations like yours to set the benchmark for governments. We've seen this in Uttarakhand relief. Shantanu would know. The army came to us and said, please tell us how you organize your systems. You do it so well during your crisis. So this is an important time for you to work with the government and set standards for them. Working with other organizations, not necessarily Christian organizations, great time to do that. You want the basic converging point is that you want to serve the same people, then partner with them. Don't compromise on your values and standards. But you have no option of being exclusive and doing your own business. So this is a time to do partnerships. So find some ways to do that as an organization. With the government, yesterday we were talking about in that board meeting, they promised quite a few things for our customers, for our communities. A lot of them have not reached. You have a great opportunity to step in and help the government. Irrespective of whether you're a hospital or anybody, as long as your vision and mission is achieved.
Thank you, Dr. Jayakumar. One of the response that I would like to give for the first question, David, for the previous slide. The first question is like, we cannot continue to be in the old ways of doing fundraising or resource mobilization or getting support are becoming irrelevant. We have to become more creative. We have the responsibility to become more creative and look to new ways of raising resources. That is the need for the hour. So when we want to look at donors, when we want to look, don't just be continue to remain with the old donors. Trying to explore new donors. Who will be the new donors? Who will be sensitive? Who will be able to support us? So those are the things that we want to suggest. And also, as Dr. Jayakumar was saying, partnership. For example, the next question which comes from Mani Philip, when the government asked FCRA organizations to do some COVID initiatives, one of the things that we did in CIM is CIM and CMCT, Christian Mission Charitable Trust, we partnered and we continue to do the COVID initiatives. So we have to explore partnership. We have never done this before. So these are new ways, unimaginable things that are going to happen. Let us be ready for that. I think the next question also from Mani Philip is very, very important. Creating a new organization culture at the time of crisis. Would it be hard as the staff are already in fear of the situation? Dr. Jayakumar?
Yeah, let me say this. For some strange reason, staff in the organization rise to crisis much more easily than to business as normal. We've seen this quite a few volunteers, whether it is tsunami, any other crisis that we have gone through, the way staff reach out to management leadership and say, is there any way we can help? Great opportunity for leaders to seize that moment, because NGOs are not made up of job descriptions, but we are made up of a spirit of volunteerism. Use that time to build that new culture. You would see staff will be willing to do 24/7, hard places, no food, difficult places to stay. We have seen this over and over again. As someone who has led that organization, you feel so humbled that you're a leader of that kind of an organization. So you want to really use that moment to create that culture. So as you move on, that becomes a new normal for the organization. Staff living in fear is a huge assumption. You want to appeal to their spirit of wanting to serve. The mode and the method may be different, but you really want to mobilize that moment to serve. This is a leadership. Unfortunately, you'll have to lead from the front in this organizational culture business. You cannot delegate it to your HR department or anybody else and say, you develop the organizational culture. This is when the CEO steps up and be counted for it.
I think the other aspect of that too that I've observed when organisations go through tough times is that at the lower level, new leaders emerge. And it's important for the senior managers to keep an eye on the new people, emerging leaders at the shop floor, if you like, at the lower level, and provide encouragement to them. Because in many cases, in a crisis, things have to be managed in a devolved way. Central control is important for some things, but many of the day-to-day activities have to be done perhaps very quickly and out at the grassroots of the organisation. And so you have to keep your eye open for people who are prepared to take leadership responsibility and take initiative and provide them with the support, because those are the people who will lead you out of the organisation, out of the crisis at the lower level. And that's at least as important as things that are done from the centre, in my experience with organisations that have had tough times.
Just building on what Dale just said, this is the time when second line leadership emerges. Keep an eye on that. You want to build on that. Second is when you see younger leaders emerging, give space. This is your time to let go. The natural temptation during a crisis is to centralize. You do not want to yield to that temptation. This is the time to mobilize, leverage, create synergy. You see a new organization emerging as a result of this.
I agree. Yes.
Thanks, Jayakumar. That was a great lesson for us. Thank you. Next.
Just one thing, Anand,
Yes.
the comment about financial crisis in the organization from Anil. The donors too want to feel relevant. You want to appeal to that urge of donors. So your existing donors need donor education. You want to help them see how they can be relevant to a crisis like this. So we have found World Vision during tsunami, Anand would know, I think we got about 74 new corporate partnerships. World Vision wasn't great at that time. And then over time, we had to convert those 74 into regular business as usual work. We didn't know how, that was a big opportunity for us. Like I said, World Vision's budget doubled during that time. And since then, the general level of World Vision funding had increased thanks to a crisis. Crisis is a good opportunity. You don't want to waste this. You will never get this opportunity in your lifetime as a leader. So don't miss this opportunity. This is when you want to shape your future.
Dr. Jayakumar, like as Dr. Jayakumar was mentioning, in World Vision journey, we have a pre-tsunami experience and a post-tsunami experience in fundraising. Maybe for us, we might have a pre-COVID experience and a post-COVID experience. Let's be ready. You know, there are God works in mysterious ways. We should be ready. I think Professor Vasant, principal of UTC, Principal Vasantrao has raised his hands. Brother, can you ask your question? David?
Yeah, Mr. Vasantrao, you're unmuted. You can ask now. I think you got muted again, sir.
Unmute myself. Okay.
Yes.
Thank you very much, dear friends, CMI, for this. As I want to know a little bit more about how CMI with another organization have plunged into action for COVID context. We are told that FCRA organizations are asked to fall in with the local governments. How do we do it? A little more elaboration of how you have done, so that it could also give us some way out of how we could also organize ourselves. For example, UTC is there. We have Scissors, our neighboring Christian organization. We have YMCA here. Senate of Serampur, BTSSC organization is here. How we do it, whether we can give a check to the local government for a COVID, their activities, or should it be definitely with stuff and materials? And it is said that we have to upload information about our COVID initiatives in the national level
portal. FCRA portal, yes.
FCRA portal of the government. So little more concrete information and help, so that we can concretely also participate in the same without making any mistake here. Thank
I will
you.
make it, thank you, brother. I will make it a little short. What we did was, one of the recommendations that has come from the circular is to work along with the local officials. They have given a list of, the commissioners, the health commissioner, the police, and all those things. What we did was we immediately got connected with the DGP in Chennai, and we asked them, what can we do? He was telling that, can you start distributing cooked food? So we decided to do that. And then we immediately, what happens is, we have to be aware of with whom we are working. For example, in the case of CIM, we are closely working with CMCT. We know that they have a kitchen. So we thought, okay, that's a good idea. Why can't we approach CMCT and ask them to help with us for cooking this meat, this cooked food? They were so happy that we wanted to partner with them. And we are already connected with a government official. So that's how it started. You have to be creative, and you have to be, use your sense of the discernment that God has placed in us to identify with whom we can partner. And then we wanted to start it with cooked food, but it turned out to be a dry ration kit distribution. Now we are distributing, we want to distribute about 1,500 dry ration kit in partnership with CMCT. Now, when we started doing that, many others also want to partner with us. So, there are endless opportunities. Every 15th, we are uploading this information on the FCRA portal. It's working for us. It can definitely work for you. Just, creatively start moving in that direction. That's what I can say.
Vasant, just
Rao.
one, Vasant Rao, just a thought here. UTC I'm saying Christian institutions by default will have to be involved. Basically communicating, not only you as an institution are relevant, but the God of the institution is relevant at a time like this. So that is first thought. Second is contributing to the various relief funds or care fund or whatever is one way of saying, and I would recommend that as communicating your visibility at a national level or at a state level. So that should be possibly a part of the. Third is your operations. You want to get your hands and feet dirty at a time like this. You don't, because our gospel is an incarnating gospel by default. And so you want to communicate that you are there where people hurt. So there are quite a few people groups that are hurting. In Karnataka itself, you have migrant laborers who are stuck there. The frontline health workers who need protection, for senior citizens who are of the poorer sections. So it'll be good for UTC to be out there to show that you are personally involved, that this is an incarnating gospel. That is the third piece. Fourth is clearly education along with the government. So you want to communicate this message all the preparedness message that keeps coming, authentic information to communities. So you are you're seen collaborating with first responders. And it's probably one of your more low cost investments. The last one, I think, and the most important one is this cannot be won without prayer. This would be a great opportunity for UTC to mobilize prayer. And you don't need to be face-to-face to mobilize prayer. You could just do it. So this just might be a time when our own Christian organizations will get transformed. Those are some thoughts, Vasantrao.
Thank you. Thank you. David, some more questions? David, you can. Yeah. Oh, how can we determine the common misunderstandings from the top level management to the bottom? What strategies will you suggest to identify and eradicate them? Mithun is asking from Pune. Dr. Jayakumar or Dr. Dale?
Well, as I said earlier, I think some of those early initial templates are ideal for communication. They're very simple, they're very straightforward, they're easily understood, and they allow everyone in the organisation to understand what it is you're trying to achieve, what might affect you as you try to achieve things, and how you're going about it.
And I think this is something which should be a way of life. As leaders, it's important to include them in the formation of the strategy. So they feel that this is our strategy and not the CEO's strategy or the leader's strategy or the board's strategy. So in some sense, it's a product of a process. The other piece I think which is critical is for you to communicate strategy, but make sure you hold the strategy lightly, hold your vision and mission very strongly. Invest huge amounts in developing your strategy, but hold it lightly. I would not die for a strategy, I would die for a vision and a mission of the organization. So you want to pay attention to that. Communicate, here again, you want to keep communicating to the most front line, if there is a word like that, in your organization, and be there to communicate, to show them how the strategy sandal meets the sand. Where does it become relevant? Otherwise, strategy merely is a document, a conversation between you and your board. Doesn't make much of a difference. So you want to be able to communicate to your front lines, help them see the relevance of the strategy to their real life experience. You want to be able to do that.
Another question from Dr. Sunil. The assumption is that the whole institution is being funded. In some cases, there is an assumption that whole institutions are funded, but that is not the case. Most hospitals, we have a group of doctors and hospital administrators in our participation group. So the question is, that is not the case. Most hospitals are self-sustaining only through fees. How do leaders of these hospitals respond to this situation? Any insights?
Are you saying, Anand, that or Sunil, that hospitals are already struggling with lack of sustained funding? Is that the issue here?
Yes, yes. Dr. Sunil, do you want to respond? You want to clarify on this question?
Yeah, in the sense that, we are not based on donors. We are based on the income that the hospital earns, at least for day-to-day running. And that has been severely hit. So how do Christian leaders in such a situation encourage staff or envision them? Is there any particular guideline or something that can be given to be able to keep staff motivated and focused on vision and mission?
2-3 parts here, Sunil. Let me just give it a try. Dale, you want to give it a try?
Dale? Yeah. Yes, Dale.
I think the issue of how you motivate staff through crisis is a very interesting one. And it links into some of the other earlier discussions too about making sure everyone understands what the objectives are. I'm not sure though how you can, it's a management leadership requirement to be able to persuade people to perhaps work for less pay or work longer hours if you can't get additional fees. But I'm afraid not particularly competent to talk about some of those other things that are specific to hospital funding, Dr. Sunil.
Dr. Sunil, let me give some thoughts, not specifically on hospitals and fees. Some of the things that I've heard are hospitals reaching out to their patients and former patients, simply inquiring how they are. So you create loyalty at this time, that you don't see patients merely as a source of fees, but a product of a relationship. We did this with donors. When I remember when Thane floods hit Mumbai, normally organizations like World Vision are in the business of sending appeal letters asking people to contribute. One of our donor relations person came up with a creative approach to write to our donors and ask how are they at this time. We didn't reduce them to an ATM. We want to be able to communicate to our patients and donors and others that they are not simply banks or wallets or ATMs. They are real people who are going through fear. You want to be able to communicate to them and ask them, how are you at this stage? Are you doing well? And I've heard many hospitals reaching out to patients. That day, very strangely, I received a call from my wife's diabetologist asking how my wife is. And she was one of the regular patients. I didn't expect a call from a diabetologist asking how is she, is there anything okay, how are you all coping with the situation? And I would think several times before I changed the diabetologist. Someone who cared for us, cared enough for us that we were not simply a source of income for him, that we were real people for him. I think you want to communicate that. You want to, a crisis is a good opportunity to motivate your staff. I've seen this. Our assumption that this is when staff go into depression possibly because of personal fears and other things, but definitely the organization should not be the source of depression. This is your time to motivate, show them opportunities, remind them of basics, remind them of the bigger picture. Great opportunity to do this. And I've seen this, like Anand said, the post-tsunami, if the bar on motivation and World Vision was much higher. On that, I could load quite a few new initiatives. It was a different organization post-tsunami compared to the pre-tsunami. So I'm hoping, like Winston Churchill says, a United Nations is born out of your handling of this crisis. Do well.
One of the response that I would like to place is, Dr. Sunil, I do not know how much the hospitals are looking at the CSR as an opportunity. For us, before the tsunami, we were a total failure on CSR. Whatever efforts we did on CSR, we were total failure. But after tsunami, as Dr. Jayakumar was saying, we were handling about 72 relationships, and each was different from the other. Not one can be, you cannot see a duplicate. 72 different types of engagements. So, there are beautiful opportunities. CSR is one. So I would like to just place it before you. I think there is one more, Dr. Anne Miriam. She has raised her hands. Let us give her an opportunity to speak. Dr. Anne?
Yeah, it is me, Vijay from Makunda.
Oh, okay. Okay, Dr. Vijay. Yeah. Dr. Vijay, can we see your face? Oh, yeah. Yes, doctor. Yes, doctor.
So our hospital has been through different crises in the past. Approximately 2% of our income comes from external sources. So we are heavily dependent on patient income. So we have made a very short crisis management plan in the past, which we have put into practice now. So the first one is a contingency plan that this crisis will last for 2 months. So for that, we have cancelled all the unnecessary expenses, given leave to staff wherever they can take leave, and given a fixed salary to all staff so that the poorer staff are protected, and deferred the salaries for the other staff. And a second contingency plan for up to 6 months. So if this crisis were to last for 6 months, then probably maybe contract staff might have to be not renewed because we don't need so many staff. And then what to do if the situation continued beyond like 9 months, the hospital has no income. Maybe at that point, the contract rules might change and this force majeure clauses might apply. But maybe we would also appeal to staff to work as volunteers rather than paid staff and accept cuts in their salaries. So I think we need to, it is possible for hospitals and institutions which do not have external funding to make a way to get over a crisis like this. I also think that there are certain factors which make us more vulnerable to crisis. One is when we have only 30 to 40% bed occupancy in our hospitals, or when the staff expense as a proportion of total expense is very high. So we might need to look at how to change those things so that we are better prepared for the next crisis. Thank you.
Doctor, before handing it over to Dr. Jayakumar or Dale, I'm kind of tempted to use Dr. Dale's template. Try using Dr. Dale's template. You'll be surprised. You will have some answers. Over to Dr. Dale and Jayakumar. Yeah.
Dale, you want to?
I think the idea of developing scenarios is a fantastic one for the strategic planning process when you're confronted with, well, what's really pretty much an untenable situation, isn't it? If you have to provide services but you don't have funding, then life becomes very, very, very difficult. And almost certainly the only way out of that is going to be through government intervention, I would have thought. But developing scenarios as a way of thinking about the future and developing a set of different scenarios for different futures is a very useful way of thinking about things, whether you're running a hospital or any other business, I think, any other organization. I think the other aspect of hospitals that we've seen in a number of places, and some of my relations involved in this, is actually getting the community involved in providing additional support, even if only just through expressions of appreciation for people who are providing services in a hospital, whether they are providing services as doctors or as nurses or as cleaners or as orderlies, enlisting the community to provide support to them. For example, one of my relations is working in a hospital, and when she gets home from work, often fairly late, wearing her hospital scrubs, very often her neighbours come out and give her a clap, and sometimes they offer her dinner and things like that. Enlisting the community to support, I think, is a very useful thing to do if you can manage that. In other words, don't treat this just as something within your organisation, but see what the implications are for the things that surround you, and particularly the community in which you work.
Dr. Vijay, just some thoughts I would like to offer. I think, like Dale said, it's important for us to do scenario planning. You want to peg the scenario planning not on your budget or your fund, but on your vision and mission. You want to be careful. Otherwise, you'll be reactive to the bottom line rather than being proactive in terms of your vision and mission. I would urge you to relook at your scenario planning and say, what are the opportunities during this crisis for us, for my mission and vision to be more relevant to the community where God has placed us. So that is one piece that I would like to look at it. The other is you want to look at the assets of your organization. Very clearly, Christian hospitals have huge credibility in the community. Use it to your advantage. It doesn't figure in your financial bottom line, but it'll come up in your bottom line as a mission organization. You want to really build on that. You want to look at how to use your workforce that are highly motivated, deeply committed in your Christian organization as a product of their call. Their feet is on the ground. These are assets not many organizations have. And they have a trust relationship on which you can load government programs and communicate that. So do your scenario planning based on your asset rather than on your depleting budget. You could unfortunately become a reactive organization rather than a proactive organization. We've seen this over and over again because responding to that kind of a disaster, responding to a PR disaster when World Vision's name was appearing in all kinds of newspapers for all the wrong purposes. I think almost 1 month soon after I took over the organization as the national director, didn't know how to handle this, had no clue how to handle it. But then I like the way our organizations, staff rallied around, the board rallied around, many of the other Christian organizations rallied around World Vision. And we took it on in terms of what are the strengths of the organization rather than what are the weaknesses. And plenty of weaknesses in World Vision. Anand and I are aware of it, and many of us are aware of it, deeply conscious of it. But we worked out of our assets. We did not compromise on our mission and vision. We came up at a much higher plane than where we were pre-crisis. So I think it's a great opportunity for us to rework our scenarios. Don't be reactive with your scenarios, be proactive with your scenarios. You want to, the goal is you want as an organization to finally arrive at a point much higher than the pre-crisis. After the crisis is all over and done. Well, this is when an organization's identity is molded. So pay attention to that as CEOs.
Thank you, Dr. Jaykumar.